Are Bull Terriers prone to hip dysplasia? Hip dysplasia is a common and often painful condition that affects many dog breeds, including Bull Terriers. This video will explore the prevalence of hip dysplasia in Bull Terriers, its causes, symptoms, diagnosis, treatment options, and preventative measures that can be taken. Hip dysplasia is a condition characterized by the abnormal development of the hip joint. It occurs when the hip socket is shallow or poorly formed, causing the thigh bone to not fit snugly into the socket. This results in the joint rubbing and grinding, leading to damage, inflammation, and eventually osteoarthritis. While hip dysplasia can affect any dog breed, certain factors increase the risk in some breeds. Bull Terriers, unfortunately, fall into this category. Due to their genetic makeup and breeding history, they are more prone to developing hip dysplasia compared to many other breeds. Genetics play a significant role in the development of hip dysplasia in Bull Terriers. Dogs with parents or siblings affected by the condition are more likely to inherit it themselves. Therefore, responsible breeding practices that include hip screening of potential parent dogs help reduce the incidence of hip dysplasia in the breed. Environmental factors also contribute to the development and progression of hip dysplasia. Factors such as rapid growth, excessive weight, improper nutrition, and exercise patterns can worsen the condition. It is crucial to provide Bull Terriers with a balanced diet and controlled exercise regimen to maintain their joint health. Symptoms of hip dysplasia in Bull Terriers may vary depending on the severity of the condition. Some common signs include difficulty rising or sitting, lameness in the hind legs, reluctance to climb stairs or jump, loss of muscle mass in the hindquarters, and an abnormal gait. If you notice any of these symptoms, it is essential to consult with a veterinarian for a proper diagnosis. Diagnosing hip dysplasia in Bull Terriers typically involves a physical examination and radiographic imaging. The veterinarian will evaluate the range of motion, pain response, and stability of the hip joints. X-rays will be taken to assess the degree of joint looseness, the presence of arthritis, and any secondary changes that might have occurred. Treatment options for hip dysplasia in Bull Terriers depend on the severity of the condition. In mild cases, conservative management may be sufficient. This includes weight management, controlled exercise, physical therapy, nonsteroidal anti-inflammatory medication, and joint supplements such as glucosamine and chondroitin. In more severe cases, surgical intervention may be necessary to alleviate pain and improve the dog's quality of life. There are several surgical procedures available, including juvenile pubic symphysiotosis, triple pelvic osteotomy, and total hip replacement. These procedures aim to correct the structural abnormalities and provide better joint function. Prevention is always better than cure. While hip dysplasia cannot always be entirely prevented, certain measures can reduce the risk in Bull Terriers. As mentioned before, responsible breeding practices and hip screening are crucial. Potential owners should inquire about hip certifications from breeders and select puppies from litters with good hip scores. Additionally, maintaining a healthy weight, providing appropriate exercise, and ensuring a balanced diet will help support joint health. In conclusion, Bull Terriers are unfortunately prone to hip dysplasia, a condition that affects the hip joint and can cause pain and mobility issues. Understanding the causes, symptoms, diagnosis, treatment options, and preventative measures can help Bull Terrier owners manage the condition effectively and provide the best possible care for their beloved pets. Responsible breeding practices and proactive steps towards joint health are crucial in reducing the incidence of hip dysplasia in Bull Terriers and ensuring their overall well-being.